These could be heart symptoms, kidney symptoms, mental health symptoms, brain fog, depression. And even if you're a young person, you get it, and you're asymptomatic, you have no symptoms whatsoever, you still could be a long hauler.
Infections among young people, they are what's driving new outbreaks in places like Michigan, Minnesota, Massachusetts. And here to talk about it is Dr. Frita Fisher, founder and president of Midtown Atlanta Nephrology. She's board certified in nephrology, internal medicine, and pediatrics. Dr. Fisher, welcome back to start your day.
Thank you.
First question, why do you think we're seeing such a rise among younger patients? What's behind it?
We are seeing the rise, one, because those variants, that B117 variant that originated in the UK, Sharon, that is way more contagious, more transmissible, and it may possibly be a little deadly. Also, folks just have COVID fatigue, pandemic fatigue, and we see our young spring breakers who are out, they're not socially distancing, many of them, they are not wearing masks. And so now we have the case of the variants on the rise and the spread is just continuing. The other thing is that, on a positive note, now that many of our seniors, we have 75% of our seniors over 65 years of age with at least one dose of vaccinations. And so now many of them are immune. And so the numbers are rising in the young folks.
So the rise in the young folks does not necessarily mean that we're seeing a rise in those hospital beds in use, but I still keep coming back to it. Are you worried about the long-term effects? People who contract COVID at a young age, they beat it, so to speak. Are there lasting health concerns?
That's a very good point. Absolutely. We know that at least 10% of people who get COVID-19 infection become long haulers. They have symptoms lasting longer than 3 weeks. And these could be heart symptoms, kidney symptoms, mental health symptoms, brain fog, depression. And even if you're a young person, you get it, and you're asymptomatic, you have no symptoms whatsoever, you still could be a long hauler. And so we still don't know what's to come from the COVID-19 infection, which is why even in our young people, especially in our young people, they must be responsible and stop spreading COVID-19.
Part of the responsibility for young people is going to be get the vaccine as it rolls out to different age groups. Teenagers, we've learned, as young as 16, they can now get it. In many places, there are reports of encouraging results in testing on even younger children. So what are the next steps in that process? Because everybody wants to be able to start the new school year as safe as possible.
Yes. Now, Sharon, you have brought up some very positive news. We already knew that, especially with the Pfizer vaccine, that children as young as 16 could get vaccinated. But now studies show us that children between the ages of 12 and 15 have a 100% efficacy with the Pfizer vaccine. And studies have also started in babies as young as 6 months old. So trials have started with babies 6 months of age up to 11 years. And so it's looking like soon the children will be vaccinated. And we've been talking about herd immunity, but unless you get children involved, because 22% of the US population is children, without them, you can't have herd immunity. So we're getting there. We also have teachers being vaccinated. And so we're almost there, but we're not there, because not to be gloom and doom, but we have to remember that we have over 60,000 cases a day. We still have about 1,000 deaths a day. If you just stop and think about those numbers, Sharon, I think we get desensitized because all we do is talk numbers. Imagine 1,000 people falling each day due to COVID-19. We have to keep working, although the light is indeed at the end of the tunnel.
How can universities and schools help? We already saw Rutgers, Cornell announcing that they're not going to let students come back to campus unless they are vaccinated in the fall. What about high schools and middle schools and elementary schools? Do you believe they'll follow their lead? Because as you know, to get your kids enrolled in even a basic public school, they have to have certain vaccines.
Exactly. And that's the thing that gets me. We've been getting vaccinated all of our lives. We've had recommendations and rules to get vaccinated. And so I love the fact that so many universities are making it the rule. You cannot come back if you're going to pose a huge health threat. And so I do foresee there being recommendations in the future for children, but first we have to finish up all the trials, get the vaccinations approved in children, prove that they are safe, and then I do believe in the future we will move toward that, but we don't know just yet.
Yeah, I mean, I have friends who say, well, I don't believe in vaccines. I said, but what did you do about school? And well, he had to, because he was going to go to school, so I had no choice. If we can encourage people in that way, you hate to force people, but, for the greater good, it seems like that would be beneficial. Dr. Frita Fisher, thanks so much for being with us once again. Start Your Day. We'll be back in just 2 minutes.
Closed captioning brought to you by Nutrisystem. Lose weight and get healthy with meals delivered to your door.